Care India, National Development Organization, helps alleviate poverty and social exclusion by facilitating empowerment of women and girls from poor and marginalized communities. We have joined hands with AXA, a global insurance firm, to implement Where the Rain Falls project, which aims to increase the resilience of 3,000 tribal women and their households in 40 villages of Jashpur district of Chhattisgarh in India, to shocks and stresses around water, and improve their access, control and management of natural resources over a period of 3 years. Care India has worked with the communities on soil and water conservation, climate resilient agriculture, collectives, inclusive governance and gender. This film is about our work on promoting effective collectives in Where the Rain Falls project. Climate change has a greater impact on communities that are mostly dependent on natural resources for their livelihoods and who have the least capacity to respond to natural hazards, such as droughts. Amongst those communities, women commonly face higher risks and greater burdens from the impacts of climate change in situations of poverty, and the majority of the world's poor are women. Women's unequal participation in decision-making processes often prevents women from fully contributing to climate-related planning, policy-making and implementation. In India, in Chhattisgarh state also, women form the core of development activities in rural villages. They are participating in all the activities at both the levels of household and farm. These women are also a part of small voluntary association known as Self-Help Group or SHG, preferably from the same socio-economic background. They come together for the purpose of solving their common problems through self-help and mutual help. The SHG promotes small savings among its members. The savings are kept with a bank. In all the major government livelihood programs in India, especially in National Rural Livelihood Mission, implement the new strategy of poverty alleviation woven around community-based institutions, especially through SHGs. Therefore, formation of SHG was a major step towards implementing all developmental activities. As a mechanism to enhance Adivasi women's covered under Where the Rain Falls project of Care India in Jashpur district of Chhattisgarh, participation in the village development committees and in livelihood-centered discussions and decision-making. Self-help groups have been organized or revived in the project villages. Over the project period, these SHGs have provided an accessible platform to these women to come together, organize, save and meet their consumption credit needs, and to start taking small production loans. Various trainings were organized for these SHGs in various aspects of basic processes and bookkeeping, best practices of management and leadership, SHG visioning, training in income generating activities like collective farming, goat rearing, grocery shop business, mushroom cultivation, lark cultivation, and procure and sale of non-timber forest produce. A healthy community is a form of living democracy, people working together to address what matters to them. Care will continue to mobilize and strengthen self-help groups to empower women, develop their leadership abilities, and increase their resilience to climate change impacts.